The NLC TUC UK project on building workplace capacity to combat HIV and AIDS, it's a very important project practically for the Nigerian Labour Congress in terms of going to the workplace to ensure that capacity of trade union members are built to respond to the issue of HIV and AIDS. Periods to these, we had situation where employers will sack our workers, our members, because of their HIV and AIDS positive status. And the NLC with its members, affiliates, started a campaign in the country around the workplace, building consciousness of workers that HIV and AIDS is a right issue. And at these very critical points, the TUC UK came up, to build on the work that we started in country at various workplaces to focus on the health sector and the education sector. And why the health sector is so important is that we know that the vulnerability of workers in terms of the work they do in the workplace, at the same time as their vulnerability as individuals due to their social lives and behaviors. And we'll also say the education sector is quite important because it also gives the project an avenue to reach the next generation, because these are teachers from the primary school, the secondary school, and also the tertiary institutions. So we're able to reach children in the primary school, we're able to reach children through the project in the secondary school, and we're able to reach our youths in the tertiary institution. We also know the vulnerability of youths in terms of peer influence, and this has been going on practically and changing the workplace in terms of behavioral change, in terms of people now going out to know their status, which was one thing that trade unions will never do before because of stigma and discrimination. It has also helped to reduce stigma and discrimination in the workplace because people now know the right way in which the virus spreads, that is not in terms of relation with people, but in terms of the practical way of body fluid exchange. So this has changed our people's behavior in the workplace over time since last year, and we've seen a demonstration where where we have trade unions now being peer educators in the workplace and in the society where they live. And one important component of the project is about linkage to the community. This is the first project that the trade unions are running within the country in Nigeria that has a link to the community, also giving also supporting the fact that the trade union does not exist only in the workplace, but after the 8 hours of work, they go back to the community. And it also takes cognizance of the fact that in taking care of trade union issues and rights of our members, the family members are a very critical component to look at. So the project is supporting a community health center in Abuja to offer, in fact, in the beginning we had the thought of supporting one health center, but now we're supporting two, because we also have requests from various hospitals because of the position of Nigerian Labour Congress in the country. So we're supporting two health centers right now to offer VCCT, and the outpour of people accessing the voluntary confidential counseling and testing services is quite amazing. We had a projection of about 300 on a monthly basis, but what we have since the beginning, the lowest has been 600. We're having 600, 700, and last month was very, very amazing. Very, very amazing. We had over 1,000 testing. And in all of this, we have over 3,000 so far in the few months that we've started. And out of these, we have over 200 of our members that are positive. And these we have linked to the treatment center in the government hospital. So this, the project has helped our members want to have access to testing, which is the first entry point in mitigating the impact of HIV and AIDS, both at the world of work and in the society at large. And talking about Recommendation 200, I was in Turin representing the NLC on the project also, and we had training on Recommendation 200. This also is a critical issue because the new recommendation kind of strengthened the former code, because a lot of people will ask what is the difference between the ILO code on HIV and AIDS. But this is a recommendation, is a standard, and every member country has has an obligation to report back to NLC, to report back to ILO on what they have done with the new recommendation, and they also have the responsibility of bringing it before the Parliament, which means that most country, and indeed in Africa with Hook and assessments, most of the country in Africa do not have a workplace policy. So they could use the standard of the ILO as an instrument of engagement both at the workplace and as society as large in terms of canvassing for the rights of members. But then it also afford trade unions the opportunity to push on government to ensure that a workplace policy is also developed. And in countries where we already have a workplace policy and a national policy, in the case of Nigeria, we have a workplace policy. We also have a national policy, and also presently we have a strategic framework. It also calls for us to have a review. And this is what trade unions around Africa, by the help of ITUC that is coordinating it at the level of the region, have sit down to draw a plan on how we are going to do it. Because the countries have the obligation to report back to ILO by June. So between now and June, a lot of activities will be going on in terms of recommendation 200 at all country level within Africa. For Nigerian Labour Congress, we've sent a letter to the Parliament and to the Ministry of Labour, calling them on what they intend to do with the new recommendation. We have also called for leadership meeting last month, because we expect that for NLC leadership to canvass for this recommendation, there is a need for them to understand what it all means in the first place. So we'll have leadership meeting and engagement on the recommendation, and on the 13th of this month, that is next week, we're going to have a tripartite meeting, which we are calling, and this is also a contribution of the project, the NLC-TUC project, to the recommendation 200. We're going to have all our partners tripartite meeting at the same time as all stakeholders that will help in the pushing of the the recommendation before the Parliament, and also ensuring that we have a review of the national workplace policy in line with the recommendation 200. So for us, I think in Africa, one is that we have a standard, we have an instrument of engagement. We have, even if the country, the member countries are not able to develop a workplace policy, trade unions have an instrument to engage, because our country are signatory or are members of the ILO, and so it is obligatory for them to respect the standard.